My name's Deborah and I've been a kidney patient for 35 years now. My route into kidney failure 35 years ago was type 1 diabetes, so I also have associated nerve damage. So Charcot's in both feet, damaged peripheral vision, and some fairly extensive gastroparesis. Anybody with diabetes knows exactly what I'm talking about. Now, exercise has played a huge part in my life. I've been through 3 transplants, transplanting 4 organs, and I currently have a very precious kidney transplant, which is 21 years old, and a functioning pancreas transplant, which is 13 years old. Why do I exercise? I exercise for 4 reasons. The first reason I exercise is because I don't sleep very well, and I know a lot of kidney patients suffer with this. So for me, exercise just helps me wind down every day, half an hour of exercise, and it does help me sleep at night. The second reason I exercise is it helps me sort my head out. I think we all do worry about our condition. This is for life, and sometimes it gets to us. The third reason I exercise is to keep my weight in control. Most of us take medication which can affect our weight, and I refuse to allow that to happen. And the fourth reason, the most important reason I exercise, is because I think that we need to contribute to the process of keeping us well. You can't just rely on luck that you're going to meet the right people to give you the right operation and prescribe the right medication. You have to contribute to that process. And me exercising and eating healthily and taking my medication on time is my contribution to that process. So I started Pilates about 15 years ago. I also walk every day. But today we're going to do some Pilates and floor exercises because I'd really rather you didn't watch me fall over. I'm pretty rubbish at it, but I can tell you that after every single operation I've had, the moment I'm sat out on a chair beside my bed, I have resorted to my Pilates to find some sort of inner core strength. And even if it's just moving my wrists, if it's flexing my ankles, bending my toes forward, flexing my fingers, that is the start of getting your body working again. So that's early stuff. And then you just progress as the months and the years pass. And now I walk every day like a pack of wolves are behind me. And whenever I possibly can, I join in a Pilates class. So here we go. No laughing.
So I want you to just relax, lying down and looking straight up to the ceiling. I want you to feel wide across the back of your shoulder. Your head is supported by a little pillow or towel, and make sure that it's not into your neck, so your neck is open. So you could take the towel back a fraction so that I can see your neck alignment. Lovely. Your arms are long down by your sides. Be aware of the weight around the back of your rib cage and relax into the back of your ribs. Feel the weight under the back of your pelvis so that you feel heavy under the back of your pelvis, back of your ribs, the back of your head, and your feet toes are spread. You have a triangle under each foot, and your heels relate to your sit bones in the bottom of your body, in your pelvis. Breathe in through the nose, filling the lungs wide into your ribs and into your back. As you exhale, find the pelvic floor, feel that connection under your tummy button, under your ribs and under your heart. Hold as you inhale again. As you exhale and connect the pelvic floor, the deep lower belly under the ribs which soften down and under your heart. 2 more, take a breath in through the nose. Wide laterally, thoracically. As you exhale, your belly is flattening as you draw the pelvic floor under your belly button, under your ribs and under your heart. 1 more time, breathe in wide and full. As you exhale, start to curl the tailbone towards the pubic bone towards the belly button as you roll up your pelvis into your first spine curl. We're going to do 4 at the top of your move. Inhale. As you exhale, soften the breastbone. Roll bone by bone through the vertebra into the lumbar curve. Relax all the way back to your neutral, letting your legs relax. Take a breath in, wide and full. As you exhale, tuck the tailbone. As you lift your hips, your bum goes on. Your sit bones come towards each other and push your pubic bone to the ceiling. Open up those hips. Take a breath in, wide and full. As you come down, keep drawing that pelvic floor under your belly button as you roll bone by bone all the way down. 2 more to go. Take a breath in, wide and full. Exhale. As you roll, think of sending your hips forwards. So the weight is going forwards, not into your shoulders. Stay wide and full and inhale. As you exhale again, from the back of the throat, down between the shoulder blades, slowly into the lumbar curve, finishing into your neutral, so your thighs are off. We're going to do one more. Rolling through, breathe out, peel your pelvis up and your spine as though you're peeling a piece of sellotape off the floor. At the top, hold an inhale. As you exhale, slowly roll it all the way down. Scoop into your lower belly and come down. Now, normally we do about 10, but we're going to finish on 4. Bring your feet and ankles together, bring your knees together, and take your arms away from your sides. Breathe in. As you breathe out, lift off your right hip, rolling your knees to the left, keeping your knee on your knee and your foot on your foot, so the soles of your feet are showing away. And then from your lower belly, roll it back as you breathe in. As you breathe out and you roll your hips and knees to the right, look over your left shoulder and keep your left shoulder planted. Inhale. As you come back, soften those front ribs. Roll back into the center. Inhale, exhale. Roll over to the left, looking over your right shoulder. Stay and inhale. As you come back, try and come back through the back of the ribs, the back of the waist, the back of your pelvis. Last time, inhale, exhale. Lift your hips, squeeze your inside thighs and knees together. Your top foot comes off the floor. Look over your left shoulder. Take a breath in. As you breathe out from the back of the ribs, the waist, the back of your pelvis, and come all the way back. Take your feet back to parallel and bring your arms down by your side. We only did 4 again. We do more of those normally. And then from there, roll over onto your tummy to do some prone work. So we don't need the pillow. You need your pillow in a minute. Just put your hands so that your forehead is resting down. Your legs are just long. We're just going to do a few leg lifts. I want you to be aware of the triangle under your pelvis, your pubic bone, and the 2 front of either hip. So I want you to feel even through there. And I want you to imagine you've got an ice cube under your tummy button. And you just want to lift that belly button off that ice cube so that you just connect the core gently without moving any bones. Take a breath in. As you draw in a gentle connection into your tummy, core, pelvic floor, lift one leg and lower it. And as you exhale, lift the other leg. Now, as you lift and lower the leg, we are not leaning into the other leg. Imagine you have something like a bowl of soup on the back of your pelvis that you don't want to spill. Okay, we've done 4. We're going to do about 10. Bring your legs together now and bring your heels to touch. Put your pillow under your forehead. So you have your nose free. Take your arms down by your sides. So your legs are going to be together for this version. Take a breath in. Engage your deep lower belly. Lift the nose, lift the face. Try and lift off the front of your ribs. Reach your fingers down your thigh, palms inwards, and relax back down. Keep your heels together, breathe in. As you breathe out, lift the nose, lift the face, lift the chest. Keep the back of your neck lovely and long. Widen your collarbones, inhale, exhale, relax back down. 2 more, Deborah, breathe in. Breathe out. As you squeeze your heels together into your bottom, you lift the nose and your upper body. Roll your arms into your sides, shoulder blades on the back of your rib cage, and relax back down. We'll do one more. Take a breath in. Wrap the heels together, wrap into your glutes, lift off the front of your chest, lovely long neck. Inhale, exhale, and come down. Beautiful. We're just doing a 4. Come on your hands and knees. Bring your knees directly under your hips. We want to get a lovely position here. We want to open our sit bones a little bit more, Deborah. Open up your sit bones. So stick your bottom out a bit. So your thighs are vertical. You've got an imaginary pool of a little bit of water in your lumbar curve. Lift your eyes slightly forward so the back of your head starts higher than your shoulder blades. Shoulder blades are situated on the back of your rib cage. We're just going to do 4 slow cats. Inhale. As you exhale, start to curl the tailbone under. Gently go through the vertebra so you end up looking at your knees. Inhale into your spine. As you exhale, start to take your tailbone away. Open your sit bones. Start to look slightly forward of your mat. Inhale. Exhale and curl from the tailbone under. Lift the lower belly. Lift those underneath ribs. Push and widen your shoulder blades. Inhale. As you exhale, your crown of head goes in the opposite direction to your tailbone. 2 more breathing. As you exhale, curl the tailbone, draw in the lower belly. Keep pulling that pubic bone to your tummy button. Inhale into your back. Exhale, head and tailbone away from each other. Shoulders away from ears. Last time, breathe in. And curl. Breathe out. Draw up the lower belly. Lift those under ribs. Widen across your back. Inhale. Finally, exhale. Come all the way back. Bring your toes to touch. Go into a pelvic tilt and breathe out and slowly deepen your curve going back, keeping your chest off your thighs to create a gorgeous curve in your spine. Keep that curve, feel your opening your vertebra, and then let your chest come onto your legs. Allow yourself to drop down and breathe into your stretch. And then slowly up you come. Well done. Well done.